So the next series of lectures are going to be about environmental health and just providing you a basic overview to the issues that we deal with in environmental health from a public health perspective. Now, this isn't showing up as well as I would have liked, but it says Ed was a regular guy. He worried about greenhouse effect, about the ozone layer, and about foul beaches and pesticides in food. And the world was too dangerous, Ed decided. So he never went outside again. Ed stayed in his home, and the radon got him. Which is simply to say there are a lot of the environment is everything around us, right? It's inside our home, it's outside of our home, it's where we work, it's the physical environment, it's also the built environment. So we'll talk about that a little bit more when we get to the social and behavioral, but things such as the placement of stairs versus elevators are all part of environmental health. So how it encourages or discourages behavior is also part of environmental health. So, how do we define public health? Well, environmental health, the pink area, is part of public health, the yellow block, that protects people from their environments. Environmental health often extends into other areas like planning and zoning and public works. Environmental health professionals work closely with those who protect the environment, the blue box or blue block, like the Department of Natural Resources, the Department of Agriculture, the Board of Water and Soil, as well as other areas. So, whereas epidemiology is the study of the distribution and causes of health and illness in human populations, environmental epidemiology is really looking at, is a given exposure hazardous to human health? And so we can look at it in a few different ways. And so problem definition involves often many different perspectives. The first perspective shown here is to define and approach environmental health problems by focusing on the indicator of change. Here, either an individual or a population may show a change in their health. The change may be positive, beneficial by a gain of health quality or increased longevity, or it may be negative, adverse by a loss in health quality or decreased functionality. In contrast, another perspective may focus on the scale of the environment in which the individual or population lives. Sudden changes in personal health result more from incidental exposure. These sudden changes in personal health are highly dependent on the frame of reference at the time of exposure. As population size and scope increases, time becomes less important but still necessary, and location becomes more important in identifying changes in health. And as such, there's a growing field that looks at community and neighborhood and that impact on individual health. And so there are a number of environmental health concerns. Drinking water, food, the built environment, air and chemical and radiological emergencies can all cause potential health problems for people's health, and we call these problems health effects. Now let's focus on the possible health effects of the environment. Health effects are indicated by changes in two factors, longevity and functionality. Good health is reflected in one's ability to act or function in their environment over a period of time. Longevity depends on accessibility to resources that sustain the quality of life. Decreased longevity is a significant indicator of poor health. As well, decreased functionality is another significant indicator of compromised health, not necessarily poor health. The inability to function to a personal norm is an indicator of poor health. Injury does not prematurely end life, but can hinder the capacity to function to the fullest potential. Death can be thought of, in that case, as the most extreme adverse state of health. And so, alluded to in the definition of environmental health, sometimes culture and interpersonal relationships within the population can lead to health effects. Adverse health effects can arise from the prolonged stress and depression and emotional reaction over limited resources or limited access to resources. And once we move through social and behavioral and environmental effects on health, we're going to talk a little bit more about the impact of health inequity and the impact of social justice or the lack of social justice on one's health, which really intersects in a lot of ways with environment. And so let's look at the potential hazards and the health risk for each of those. For example, if water tests show an unsafe level of E. coli or fecal coliform levels, the people who drink that water could become ill with, quote, the stomach flu, diarrhea, or worse. If waste has not been disposed of properly, it can become a breeding ground for rats and mosquitoes, causing illness, or even allowing toxins to seep into the drinking water supply. In the built environment, asbestos could cause respiratory disease, lead exposure can cause brain damage, and radon could cause cancer. Local agencies deal with structural housing issues. Air pollution can cause respiratory distress, and emergencies can cause distress and unknown health effects. And environmental health explores and breaks links between toxic environmental conditions and health effects. What action is taken depends on legal authority from the legislature and policy directions from the administrative branch or rules, these local ordinances, as well as from science and best practices. And this is really part of the role of the Environmental Protection Agency in this country. And if you look at all the things, when we talk about the environment and water and land and the built environment and air, as well as emergencies, and you look at the list of potential health effects, and these are just the acute health effects, not the long-term ones, you see the very important role that the EPA and other agencies play in protecting our health. And so when we're thinking about environmental effects on health, water, for example, is a big one. So globally, at least 1.8 billion people use a drinking water source that is contaminated with feces. Contaminated water can transmit diseases such as diarrhea, cholera, dysentery, typhoid, and polio. And contaminated drinking water is estimated to cause over 500,000 deaths from diarrhea each year. By 2025, half of the world's population will be living in what is considered a water-stressed area. And in low and middle income countries, 38% of healthcare facilities lack improved water sources. So think about that. When you go to a hospital, you assume that they have clean water so that the physicians and those treating you are washing their hands, but also that you have access to clean water. And 38% of low and middle income countries cannot say that. And of those low and middle income countries, 19% do not have improved sanitation, and 35% lack water and soap for hand washing. And so, according to the World Health Organization, some 842,000 people are estimated to die each year from diarrhea as a result of unsafe drinking water, sanitation, and poor hand hygiene as a result of not having access to clean water. But diarrhea is largely preventable, and the deaths of 361,000 children under the age of 5 each year could be avoided if those risk factors were addressed. And so where water is not readily available, people may decide that hand washing is not a priority, because why bother to wash your hands in dirty water, thereby adding to the likelihood of diarrhea and other diseases and illnesses which can result in death. And so if we just look at the environmental effects on children, for example, we know that more than 1 in 4 child deaths could be prevented each year just by cleaning up the environment. Every year, environmental risk factors such as indoor and outdoor air pollution, secondhand smoke, and unsafe water and sanitation take the lives of 1.7 million children under the age of 5, and that accounts for about a quarter of all childhood deaths globally. Worldwide, between 11 and 14% of children aged 5 and older currently report asthma symptoms. Many of these symptoms are related to indoor and outdoor air pollution, secondhand tobacco smoke, pollens, and indoor mold and dampness. Every year, 570,000 children under the age of 5 die from respiratory illnesses such as pneumonia, which is linked to both indoor and outdoor air pollution, and secondhand tobacco smoke. Diarrheal illness, as I said, are among the main causes of death for children under age of 5. And every year, again, 361,000 children under the age of 5 die from diarrhea, which could be prevented by improved access to clean water, sanitation, and hygiene, and the provision of clean water in order to and restroom facilities. Chemical pesticides are widely used to protect crops and control certain disease vectors, such as mosquitoes, to remove vegetation in public areas and control pests in home. However, unsafe use, storage, and disposal of pesticides are the main cause of acute poisoning amongst children each year. Malaria, the most important vector-borne disease globally, is transmitted by the bites of infected Anopheles mosquitoes, which prefer clean, standing, or slow-moving fresh water. Better environmental management of those water bodies could prevent more than 300,000 deaths in children under the age of 5. And young children are more vulnerable to the toxic effects of lead and can suffer profound and permanent adverse health effects, particularly on the development of the brain and nervous system. And since young children spend relatively large amounts of time on the ground and frequently put their fingers and other objects in their mouths, they have an increased risk of lead exposure. And we'll talk about lead exposure in the US in particular more when we talk about water pollution. And we know that it's important to protect children from poisons. Children are particularly vulnerable to poisons because of their smaller size and less developed physiology, and because they like to explore and put those items in their mouth. Common poisons include toxic household chemicals, cleaning products, weed and insect killers, medicines, types of fuels like as petrol, kerosene, solvents, seeds, berry mushrooms, as well as in, not so much in the United States, but in certain parts, the venom from snakes and particular spiders. And while much about the origin of childhood cancers remain unknown, environmental risk factors such as solar and ionizing radiation, secondhand tobacco smoke, aflatoxins, and some pesticides, to name a few, contribute to childhood cancers and continue to impact cancer development later in life. And finally, climate change. It's one of the greatest new threats to children's environmental health. Higher temperatures and higher levels of atmospheric carbon dioxide favoring pollen growth are associated with increased rates of asthma. Disruption to fresh water supplies and food crops harvests will exacerbate malnutrition and stunting, and more frequent heat waves will put children at risk of heat stress, renal disease, and respiratory illness. And again, these are just the risks to children. There are other risks to adults as well. And so when we think about, again, that impact and how this all works out, the impact on our health is a result of human activities, agricultural, industrial, energy production, and the use and management of water and waste, urbanization, the distribution of income and assets within and between countries, the quality of health services, and the extent of protection of the living, working, and natural environment. And that interaction with the physical and chemical environment, again, air, water, food and soil, chemical composition, including radiation, climate, including temperature, humidity, precipitation, and seasonal changes, and our biological environment, the type and distribution of pathogens and vectors, as well as their habitats. And these all impact each other. So the arrows go in each direction. And so it's important to know that we really are part of this whole system. And the things that we do have an impact on our physical and chemical environment, our biological environment, and those things interact with one another to influence our health. And so some examples of environmental health activities include the assuring the normal growth and development of all children and adults. So researching and educating about contaminants in fish, checking that medical x-ray equipment is working properly, assessing housing of children with elevated blood levels, as well as checking youth camps, manufactured home parks, swimming pools, and evaluating and consulting on mold, radon, lead, asbestos, among other concerns. Environmental health activities and the groups that carry out the work vary by location, but the essential services remain the same everywhere. Some examples of preventing the spread of communicable diseases are shown here. Environmental health staff work with epidemiologists on food and waterborne outbreaks to evaluate and communicate health risks, as well as to assure compliance with regulations like the Federal Safe Drinking Water Act, state food codes, and public health nuisance laws. And examples of protecting the protecting against environmental hazards and preparing to respond to disasters. We have examples that include responding to floods and tornadoes, consulting with emergency preparedness staff on food, water, chemical, and radiological concerns, and developing rules and ordinance based on community determined risk. These essential activities might be housed within the public health department, but also the departments on water, inspections, or planning. And so it's a pretty big tent. And ultimately, the goal of environmental health is to decrease the widespread threat to human health and life on Earth posed by contamination of the environment, and to improve the prospects for a sustainable and healthy future for our children and their progeny with a focus on prevention. And so the next series of lectures, we're going to tease this apart a little bit more and look at the impact of air pollution on public health and water pollution in public health. And for the second one, we'll be talking a bit more about the impact of lead poisoning in Flint, Michigan, and the public health response.